Hello everyone, I am Vidya Chinmaya, previously working as Senior Quality Officer in a private hospital in Kuwait. I would like to say a few words about the benefits of using evidence-based practice in healthcare setting, which I learned from Raghava International Statistical Institute, well known as RISI, an authorized training center of NAHQ. I had a long time dream to become a CPHQ. Due to family commitments, I couldn't pursue my studies earlier. Since I had 5+ years of work experience related to quality and patient safety, I had got job offers recently. I had also joined to work, but I didn't feel like continuing in my job until and unless I become a CPHQ, because I wanted to make sure that quality and patient safety principles are professionally acquired by me first and then applied in healthcare services with the said professional approach, so that both the patients as well as the employers who hire me will get the utmost benefit from the quality and patient safety principles. I came to know about RISI through LinkedIn and through my friends, and then I made up my mind strongly that I should join RISI for the CPHQ course. Looking back, I did realize that my decision of joining to RISI was extremely worthwhile. After joining RISI Institute, I really learnt many things about the concept of evidence-based practice, which needs to be implemented in the healthcare settings. Though I had gained knowledge in my work experience, it is in the context that most of the healthcare organizations at present go for continuous quality improvements using traditional approaches. I learned from RISI that traditional approaches are no more adequate for performance improvements related to quality and patient safety. In healthcare, quality improvement and patient safety are critical components for ensuring positive health outcomes, and both traditional approaches and evidence-based practices play a vital roles, but applying the evidence-based practices are much outweighing the benefits of old traditional approach, which I'll be explaining now. Point number 1 in traditional approach is that decision taking was based on clinical experience and expertise. Healthcare providers were relying on their personal experience and training to make decisions, which may sometimes be guided by historical practices, so there could be a potential bias in decision making. Whereas evidence-based practice uses the best current research, clinical trials, and systematic reviews to standardize care, reducing variations caused by differences in clinicians' experience. For example, standardized protocols for managing sepsis. Research and clinical trials show that early intervention with antibiotics, fluids, and other treatments can significantly reduce mortality in septic patients. By following proven guidelines, we can ensure timely and appropriate care for all sepsis patients, regardless of clinicians' experience. Point number 2 in traditional protocols being practiced might not be always updated with the latest research findings. For example, some hospitals or clinics may prescribe antibiotics for common cold symptoms, despite research showing they are ineffective against viral infections. Outdated protocols can lead to unnecessary antibiotic use, contributing to resistance and other health risks. Whereas evidence-based practice recommends that the healthcare providers can reduce the unnecessary use of antibiotics, align treatment with the latest research, and help combat antibiotic resistance by implementing antibiotic stewardship programs. Hence, evidence-based practice is data-driven, supported by research evidence. Point number 3 in traditional approach is that limited use of data. Decision making is in the traditional approach may be less data driven. Quality and safety improvements are often based on past outcomes, observational data, or anecdotal evidence. Whereas evidence-based practice uses statistical scientific approach to collect the data, to validate the data, to analyze and summarize the data using latest softwares like Minitab, Power BI, SPSS, etc. instead of relying on traditional approach of using Excel worksheets. How can we validate the data? We can use Minitab for data validation while selecting sample sizes, while validating safety culture survey questionnaire, while doing Lean Six Sigma projects, etc. Focusing on quality of data and the statistical approach paves the way for appropriate decision making in the leadership level at the right time. Healthcare data analytics also helps the leaders in optimizing utilization of resources without compromising the quality of care and ensured patient safety, reduced cost to the patients. Point number 4 in traditional approach is that we can see suboptimal outcomes. Without robust evidence with the data to guide decision making, healthcare outcomes can vary widely and patient safety may be compromised. Whereas using evidence-based practice, continuous improvement can be achieved using data to identify gaps in care, areas for improvement, and implementing strategies to close those gaps and to address variations. Point number 5 in traditional practice is that it focuses on reactive approach, which are more often reactive, meaning interventions and changes are made after a problem has already been identified, such as an adverse event or clinical failure. We were doing root cause analysis after an adverse or sentinel events happened. Evidence-based practices often focus on proactive interventions. How can we focus on proactive interventions? We can do that using statistical methods such as predictive analysis with correlation and regression, inferential statistics with the hypothesis testing and estimation, using data trends to anticipate potential issues or risks using Minitab software. Evidence-based practice recommends proactive risk management, which should be organization-wide. Earlier, the risk management was focusing on department-wise only. So, data-driven decisions allow healthcare providers to anticipate and prevent potential complications or adverse events before they occur itself. For example, by doing RCAs for high-risk near-miss events, root cause analysis for high-risk near-miss events, we can foster a culture of safety by minimizing risks before they escalate into serious problems. The last point about traditional approach is that the traditional approach was focusing on patient-centered care. Focus was on patient alone in the traditional approach. Whereas through evidence-based practice, we can improve healthcare outcomes at a population level. Data-driven decision making not only improves individual patient care but also can lead to better health outcomes of population on a broader level. By aggregating data from diverse patient populations, as I said earlier, using predictive analysis and inferential statistics, healthcare organizations can identify emerging health trends, track disease outbreaks, and implement targeted interventions for population health improvement. Hence, the benefits of using evidence-based practice in data-driven decision-making are numerous, ranging from improved patient safety and health outcomes to enhanced operational efficiency, reduced variance in the care provided, cost effectiveness, enhanced patient satisfaction, reduced risks, and optimized utilization of resources. Data driven decision making needs high quality of validated data to prevent medical errors as well as to improve the quality of service provided. Raghava International Statistical Institute RISI helps its students to understand the concept of health data analytics and the performance improvement methodologies using high quality of data and tools and techniques to improve the process and system in the organization through their in-depth knowledge imparting CPHQ course. The CPHQ course really made me to understand the intensity and power of data in decision making in healthcare service system to ensure quality and patient safety. I thank respected Dr. Tennarasu sir, the founder and coach of RISI, for imparting such an insightful knowledge, guidance to go ahead in the journey of professional life. As sir always used to say in the class, understand the concepts, try to apply them in your organization. It is not good to simply focus on getting CPHQ certificate. You need to apply those concepts of evidence-based practices while performing your work in the organization. I am hoping that I will get an opportunity to do that soon in the near future in whichever organization that I will be getting in. Thank you all for sparing few minutes to watch this video. I wish you all to have a great professional work life ahead. Thank you.